I recognize myself for 5 minutes. Mr. Commissioner, I want to go back to the beginning. Let's talk about the definition of nursing home deaths. I've been trying to, I've obviously read the report. I heard the conversation that you had with my colleague, Senator Skoufis. Other folks have asked you about it. I have to admit to you, it does not, I'm confused. And I'll just pose the question, and the rest will be for you to kind of convince me that this is the right way to do it. If I'm not mistaken, please correct me if I'm wrong. At the beginning of the pandemic, the reports that were being put out included data related to people who were nursing home patients who then were admitted to hospitals and died there. Is that incorrect?
At the beginning of the pandemic, when somebody died, we assumed that what was going to happen was people who got sick would end up going to a hospital, and we were reporting the data from the hospital as someone unfortunately died. Ultimately, as we move forward.
Sir, just.
Yeah, sorry, yeah.
This is the question. This is the question, because I have a few very specific questions. This is the first one. Is it correct or incorrect that at the beginning of the pandemic, before I believe the 731, I'm trying to look for the exact report, but that there was at a point at the beginning of the pandemic, patients who were nursing home patients who were admitted to hospitals who died were counted towards the deaths of that nursing home. And then at one point you stopped doing that. Is that correct or incorrect?
The issue here is that someone comes in and the worry is that you will end up counting them twice. You'll count them as nursing home, you'll count them at a hospital. So you have to avoid, this is the issue.
So I will ask you one more time. I'm sorry. I'm asking one more, please just answer this. This is the question. The question is it correct or incorrect that you at one time reported it one way and now are choosing to report it another? Because this is the crux to me.
I get it. Yeah.
Okay. I'm gonna give you 30 seconds. Go ahead.
No, I'm gonna say we reported in as someone who's died in the hospital. If someone came from the nursing home, they went to the hospital and they died in the hospital, we reported as they came from the hospital. We then started to ask and trying to get information about who died in the nursing homes, and we started reporting that and getting information from the nursing homes. And we do not want, as I mentioned before, we don't want to double count and say this person died here and also died there.
But it's as my colleague Senator Skoufis pointed out, no other state keeps the numbers like this. This is the concern that we have, sir. I understand that we were all hold on. Everybody's like, is that incorrect?
Oh, the issue here is there was a lot of confusion up front because this was an evolving process. This is what I was sort of trying to say in my presentation, that you have to go back to that point in time when we had information coming in and we assumed one thing, and then we found out that there was another problem there, or that the numbers were going up, or the numbers we were going to predict.
Right. This is the concern. Yes. I'm going to tell you what the concern is. I'm going to tell you what the concern is. There is, because I know that you went like this when I said there was no other state that's doing it like this, and then you kind of went back and said we have to look at that time. I get it, and none of us is trying to castigate y'all here for the very difficult work that had to be done. But it seems to me that patting ourselves on the back for victories is a little bit far-fetched, considering that we have still more deaths than anybody else in the country, both in nursing homes and in overall deaths. And the concern here, sir, is that it seems that definition, you have to admit that maybe you never will, but the definition, the fact that the definition was changed, that the report before a certain date included those numbers and then afterwards did not, it seems that what y'all are doing is just trying to minimize, and nobody says that you went into these nursing homes and threw people off a flight of stairs, but we are saying that to be able to, moving forward, if we want to get clear information, we need to get clear information so that we can make better policy. And it seems to me that if the definition that you're insisting on keeping on the books is one that no other state utilizes, and that it makes you look better than what y'all did when y'all actually did, that's a problem, bro.
Yeah, but you know what, Senator? There are 14 states in the United States that don't even report nursing homes, don't even report their data.
I'm not talking about those 14, but okay. But then what about the other 36 or what have you?
And some of them don't report presumed. We are transparent. All I'm saying, Senator, is that we have been incredibly transparent on information. But the one thing that we also is that we have been, Senator, And we have also, the one thing you know me, I will not provide information unless I'm sure it's absolutely accurate and out there. And I've done that on so many other things that you and I have worked on.
The only thing, and I want to respect the time, as I'm respecting for everybody else, I will do it for myself as well, and I will cut myself off before saying, it seems, sir, that in this case, you are choosing to define it differently so that you can look better, and that is a problem. I'm sorry, my time is up.